Hello, everyone. As many of you know, I was privileged to be invited to the World Congress of Hair Research in Seoul, South Korea. There are over 1,200 dermatologists, hair researchers, industry specialists, and yes, some trichologists as well. There are also over 300 presentations over the 4 days. I've had many requests from World Trichology Society members and students who were unable to attend, asking me, can you redo your presentation for us? And I'm delighted to inform you that I have done that. My presentation was for international researchers and physicians. And what I've done with this recording is to repeat exactly the same presentation as I gave to them at the Congress. I hope you find this presentation informative, and I'd like to thank all the students and members of the World Trichology Society for your support. I hope you enjoy the presentation. Good morning, everyone. Thank you to the Congress organizers for inviting me to South Korea. My name is Dr. David Kingsley, President of the World Trichology Society. Today I'll be discussing the role of the trichologist in the management of hair loss and scalp disorders. This is an important topic because although the term trichologist is used internationally, it does not mean the same thing in every country, and I'm going to talk a little bit about that later. In this presentation, I'll be focusing on the non-physician model of trichology. I have no disclosures to report. We've heard today from my esteemed colleagues here on stage about chemical exposure to the hair, molecular modulation, and the evolving understanding of the scalp microbiome. These advances deepen our understanding of hair biology. But patients do not arrive at a dermatology clinic as scientific concepts. They arrive worried, they present with shedding, anxiety, confusion, and often delayed care. Therefore, the challenge is translating this complex science into practical clinical management. In trichology, this occurs through structured assessment, triage, education, and referral. For many patients, the journey into care for their hair loss is highly fragmented. Patients don't usually enter treatment in a straight line, and many begin managing their hair loss very late. Before seeking professional help, many self-treat, seek advice from Dr. Google, purchase supplements and cosmetic products, and receive conflicting recommendations from friends and family who think that they're experts. By the time they reach a dermatology clinic, many are already frustrated, fatigued, and struggling with treatment adherence. In many cases, the issue is not a lack of available treatments, but the lack of structure within the patient pathway. Unfortunately, in many healthcare systems, patients may wait weeks or even months to access dermatology care. During that time, many continue to shed hair, worry and experiment with products that have little or no effect. This creates a practical need for interim guidance, monitoring, and early recognition of emerging hair and scalp disorders. Trichology often operates in the space between cosmetology and dermatology. Cosmetologists focus primarily on appearance, while dermatologists focus on diagnosis and medical treatment. In many healthcare systems, physicians may have limited time for hair loss consultations, and follow-up opportunities can be minimal. The trichologist can contribute alongside the medical management through patient education, ongoing monitoring, supportive care guidance, and reinforcement of treatment adherence. However, one challenge internationally is that the term trichologist has no universally standardized definition. In some countries, the role is physician-based and medically regulated. In others, including here in South Korea, the United States, the United Kingdom, and Australia, it more commonly refers to a non-physician hair and scalp specialist. As a result, professional credibility depends not simply on title, but on the quality of education, ethical standards, scope of practice, and regulatory oversight. When these structures are clearly defined, they help improve physician confidence in trichologist referrals. As mentioned previously, within the non-physician model, the scope of the trichologist includes assessment, education, pattern observation, and referral facilitation. The role of the trichologist is to work with physicians to provide additional patient support. Clearly defined boundaries improve patient safety and interdisciplinary collaboration. This leads to one of the central functions of trichology, in my opinion, and that is clinical triage. The assessment process includes detailed history taking, evaluation of hair and scalp patterns, recognition of inflammation, and identification of potential red flags. From there, patients can be categorized according to urgency, risk level, and the most appropriate referral pathway or medical specialty. The goal is to help guide the patient towards the most appropriate management plan. To help determine the patient's most appropriate referral pathway, the trichologist must be able to distinguish between common presentations such as patterned hair loss, diffuse shedding, inflammation, and possible scarring. Differentiating diffuse shedding from patterned hair loss or inflammatory from non-inflammatory scalp presentations guides safe triage. Early recognition and clinical judgment may help prevent delay, mismanagement, and in some cases, irreversible hair loss. Supportive care plays an important role in long-term management. Many patients seek supportive strategies while waiting for medical consultation or while treatments take time to work. And as we all know, treatments can take up to 6 months before you can even see any improvement. Supportive strategies may include nutritional guidance, cosmetic approaches, low-level light therapy, and other non-medical interventions. The responsibility of the trichologist is to keep these interventions evidence-informed, realistic, and within scope. Supportive care should complement medical management with improved patient adherence and engagement. For physicians, structured trichology provides practical value. Patients may arrive with more organized histories, improved understanding, and more realistic expectations. Ongoing trichological support may also improve adherence between medical visits. This allows the physician to focus more efficiently on diagnosis and medical management. This will help improve continuity and efficiency of care. As we all recognize, hair loss carries a substantial psychological burden. It can affect identity, confidence, social behavior, and emotional well-being. Patients frequently experience anxiety, depression, reduced confidence, social withdrawal, and treatment fatigue. These factors directly influence adherence and long-term outcomes. If the patient becomes discouraged and stops treatment, even the best medical plan may fail. Therefore, psychological support should be considered part of effective long-term hair loss management. Cosmetic improvement should not be underestimated. Visible cosmetic improvement may provide psychological benefit long before medical treatments begin to show visible results. Cosmetic options may include fibers, styling approaches, toppers and hairpieces, or other appearance-focused interventions. In my published study of the influence of cosmetic treatments on quality of life, I found that cosmetic interventions significantly improve quality of life, self-esteem, anxiety, and social confidence in women with female pattern hair loss. These approaches can reduce distress, improve confidence, and help patients remain adherent while longer-term treatments take effect. Many non-medical interventions may also play a supportive or complementary role alongside physician-directed treatments, with several newer fields now attracting growing interest. These include RNA-related therapies, peptides, exosomes, and microbiome-targeted approaches. Many are still evolving, and commercial claims may move faster than the evidence. As these technologies evolve, maintaining evidence-based standards and clear clinical pathways becomes increasingly important. Looking ahead, the World Trichology Society will continue to advocate for clearer educational standards, ethical practice, interdisciplinary engagement, and evidence-informed patient care. As hair science evolves, stronger professional frameworks and closer collaboration between physicians, researchers, and trichologists will become increasingly important. In summary, the modern trichologist contributes through structured assessment, triage, education, supportive care, and referral coordination. When appropriately integrated within multidisciplinary systems, this role may help improve continuity, treatment adherence, and overall patient management. It also helps patients access the appropriate level of care earlier and remain engaged over time. The goal is not to replace medicine, but to strengthen the clinical framework surrounding it. These are selected references supporting the concepts discussed today. And thank you very much for your attention. I sincerely appreciate the opportunity to speak with you today and to contribute to this important discussion.